action.
Hi, I'm Tamara Johnson, and I'm going to be talking to you today about respiratory distress syndrome. Respiratory distress syndrome, or hyaline membrane disease, is something that babies can develop soon after birth. It is the most common respiratory issue that babies can have. The most at risk are those that are premature, which is less than 35 weeks, and those that are late preterm. So late preterm is 35 and 0 weeks up to 37 and 6 weeks. So these babies are diagnosed on their presentation. So they're tachypnic, so they're breathing higher than 60 times per minute. They can also be grunting, which is a noise we're going to hear in just a minute, flaring their nostrils just to make more room, and retracting. So retracting is movement whenever they're breathing at their lungs. And then also if they end up requiring oxygen, that is a sign of respiratory distress. So we are going to watch a little video here. This is a baby grunting, and we're also going to see some retractions. So listen, that's the grunting. Some parents think that's a cute baby noise, but that is not cute. That's respiratory distress. And then you see retraction, so that's movement underneath the rib cage, or it can be movement in between the rib cage. So subcostal, intercostal retractions. Another video that I have here for you to watch, this baby is grunting, and we're also going to see some nasal flaring. And so you hear the grunting. So the grunting is the glottis closing over the trachea, just trying to increase pressure in the lungs. And then the flaring, the baby's nares are actually opening up just to make more room in the baby's airway, just to get more air in. So whenever a baby is grunting, flaring, retracting, tachypnic, and then also requiring oxygen, that's whenever they're diagnosed with RDS, or respiratory distress syndrome. Now, babies can be grunting, flaring, retracting, and tachypnic during transition, and if they don't transition out of it, end up needing oxygen, that's whenever it changes to a respiratory distress syndrome. And the respiratory distress syndrome, it's a surfactant deficiency. So the baby's lungs are immature, or maybe they were exposed to an infection and they were not able to develop correctly. So moms who are in labor, or moms who are sick, who they know the babies are going to be delivered early, they're given steroids, so antenatal steroids, and those steroids help the lungs to develop quicker, to help get that surfactant going just from the stress of the steroids. So those babies are actually helped. And then also early administration of surfactant can help these babies with respiratory distress syndrome. So the pathology of the disease is the baby does not have enough of its own surfactant to keep the alveoli, which are the lung sacs, open. And so they're collapsing. When the lungs aren't fully developed, they develop the atelectasis, which is the collapsing of those air sacs. When this happens, that's going to impede the amount of air that's getting into the lungs, and then that ends up affecting the oxygen level in the baby, and thus the baby requires oxygen. When a baby requires oxygen, they've got hypoxemia, so the oxygen is not in the baby's blood, and we need to give that baby oxygen. With babies, you don't give them 100% oxygen, you titrate it. So anywhere between 21 and 40% is usually acceptable, and then you try and titrate. If a baby needs more than 40%, the doctor may start thinking about giving the baby some surfactant endotracheally, versus waiting for them to develop their own. So different medications that can be given with babies with RDS, kind of mentioned before, is the artificial surfactant. There's one called Curasurf that we use at our hospital. I prefer it just because you can use it in smaller doses or volumes. So you would give 1.25 to 2.5 cc's per kilogram per dose. Or another medication is called Survanta, which we would give 4 cc's per kilogram per dose. An example, as far as weight for the Survanta would be like for a 3-kilo baby, you'd end up giving the baby 12 cc's, versus the Curasurf, you could end up giving a 3-kilo baby 3.75 cc's. So it's a much nicer amount to give. The doctor would also probably order a CBC and a blood culture, just because, is it an infection reason that the baby's sick and having respiratory issues? And so they may be looking at giving an ampicillin or a gentamicin. There's also genetics, environment, and lifestyles that can put a baby at risk. So prematurity, of course. You've heard of wimpy white boys. There's truth behind that. So if you get a Caucasian white male, those babies are going to end up having the respiratory distress more commonly than others. Also, infants of diabetic mothers, babies who've been delivered by C-section, if their mom was not in labor, they're at higher risk, and also moms who have developed chorioamnitis, and so there's an infection there. Thank you.